this is a wonderful turnout, and I want to start by saying thank you for allowing me to represent you in Washington. And that's what I am. I'm your representative. And we want to hear from you. We want to hear your questions. In responding to the questions, I'll share some of the things that I feel like. I want to say this. Town hall meetings have already made a difference in Washington. How many people do we have supporting single payer? Okay, see? So, and let me say this. We want to be, we all want to be respectful of each other's opinion. I do not support it. Thank you, thank you. But we all, this is America, we have a right to express our opinions, to have different opinions. And we want to hear from those who do support single payer. My question to them would be, and I don't want to stray too much from the text, my question would be to them, do they really think the government can do it cheaper? I represent everyone in this district, and I would not be honest with you if I told you that I supported Obama's health care plan. I don't. And you have a right to know that. But do I believe that we need some type of reform? Absolutely. Thank you for letting me represent you. Thank you for being here tonight.
Mr. Bachus, I was going to ask you if you had read the health care reform bill.
Yes, I have. Not only have I read it, my staff has taken every provision apart, and this is taken up. Before I left Washington, I'd already read the original, and then they keep amending it. If you'll recall, with cap and trade, a third of the bill came in at 3 o'clock in the morning before. So the fact that I've read it now, I can guarantee you that you'll see a lot of give and take. I've signed this pledge, and it says that I pledge to my constituents that I will not vote to enact any health care reform package that I have not read personally in its entirety, and I mean the final draft. Not something that got it. And that has not been available in its entirety to the American people on the internet for at least 72 hours so they can read it too. We had an amendment in committee requiring screening of applicants for subsidized health care rejected in the committee. In other words, I voted. I wasn't on the committee, but I've told you, and I'll say again in case anybody didn't hear. I oppose giving anything in this bill to illegal immigrants. Okay. And now we also. There was an amendment requiring individuals to automatically be enrolled in Medicare to provide proof of citizenship. That was rejected by the committee. So I can tell you that the bill up there today, it doesn't even require you prove your citizenship to get on this new coverage. Now, who's going to pay for this new coverage? Including, obviously, for everybody that has health insurance and those on Medicare and Medicaid. Now, why will they? Well, because you have to reduce. There's just so much money. So you're going to have to reduce benefits. You're going to increase co-pays. And everybody's going to pay. And that's why we need, let me tell you this, we desperately need in this country, and we have needed, we have needed to control our borders. There's a slide that I want to show you, this idea that you can keep your health insurance if you want it. That's been said a lot, but the bill doesn't say that. The bill quite clearly says something else. Section 102A says private insurance plans must offer essential benefit package mandated by the federal government or be taxed. So they're going to decide. It says after 5-year grace period, individual health insurance coverage may only be offered through government-run exchanges. And private coverage will be unable to compete with the subsidized public plan. That is what I've heard that from the Heritage Institute. I've heard that from a lot of people. And I believe that, let me say this. Ronald Reagan said this, and I think it's right. The federal government, what they're going to do is they tax something, and if that doesn't stop it, they regulate it. And if that doesn't stop it, they take it over and they subsidize it. And I really believe that is progression. And let me say this. I very much appreciate the fact that we have people on both sides of this issue. This is what makes a town hall meeting. If we all came and we all had one accord and one viewpoint, we'd just be talking, we'd be slapping each other on the back and agreeing. We need to ask these type questions. In fact, that question that I think is a common misconception, and that's that you can keep your own coverage, not what the bill says. I would never vote for a bill that did not have an amendment that said that mandatory or any abortion coverage was covered. I'm not going to vote for any bill that allows the government to spend money on abortion. I think that's one of the undoing of our country. Thank you very much for attending. Thank you for your patience. It's been a heated discussion at times. I think we all feel very strongly about this. Health care it is something that's very dear to all of us. And just this turnout tells us, I think, that there are too many questions and too many unanswered questions for us to vote on a bill in 1 month.